Hello, dear parents, lovely mommies. Again on Baby Chakra, I'm Dr. Sonia Chandnani from Bombay Multi Speciality Hospital in Surat. I'm basically from Mumbai KM Hospital, but then now I'm at the city of Surat practicing as a high risk gynecologist. And we all know that nutrition is very important for all of us. From the journey in the womb till the time in tomb, it's the nutrition which carries us ahead with a healthy life, and life in general is all about health, because that is the true wealth we all can actually have. So everyone should eat a balanced, a healthy diet, everybody knows. But then it's more important for the mommies who are carrying the babies in their wombs, and especially the ones who are high risk mommies who have difficult pregnancies or are IVF conceptions. Those are the mommies who need little more care. For women who are trying to conceive, also eating takes on a whole new meaning, and they're always looking forward to what else can I do other than taking the vitamin supplements or calcium or iron the gynecologist is prescribing me. They're looking forward to some general answers that how can I make this journey a culmination into a healthy motherhood, healthy baby post delivery, and as well as a beautiful lactation period, and then the recovery post delivery. So every parent has a vision into it, and even the fathers have a great role to play. And in Indian families, the whole family is actually playing a great role. So high risk pregnancies are becoming a global phenomena, more so in our countries, which are a little kind of underdeveloped, still in the developing phase. According to WHO, around 830 women die from preventable causes of pregnancy and childbirth every day. So around these women, they actually need more care. And the most important cause is anemia, infection, or kind of difficult diseases which are related to lifestyle, and they are leading to maternal and neonatal deaths or in-womb deaths. So 99% of this is happening in the developing world, and we are one of them, and we are one of the largest amongst them. We have rural women also. We have poor communities in the cities also, underprivileged ones who may not have the money, but also may not have the access to the healthcare system. And the young pregnant adolescents these days, especially in the US, the abortion law, which we all are hearing, is going to cause a lot many more issues for the mommies. And the mommies who are having high risk need a lot more emphasis on health and more so on nutrition. So factors which put a pregnancy at a higher risk are one of the pregnancies which are having high blood pressure, uncontrolled sugars, kidney disease, or thyroid disease, any autoimmune disease, any liver disease, any infection kind of hepatic infection like HbSAg positive, HIV positive, or teenage pregnancy, an elderly pregnancy, a pregnancy with autoimmune disease. So all these pregnancies are a little more risky. The ones with twin pregnancies, all IVF conceptions, and where there was a previous loss in the pregnancies. And first timer pregnancies around 19 years of age or after 35 years of age are also a high risk pregnancy. And lot many of these are actually relating to the lifestyle factors, and which could be easily corrected by the simple nutritional changes if the mother was aware. And as a gynecologist and obstetrician, I find it very, very important to share with all of you that the recommended weight gain for Indian mommies during pregnancy is around 11 to 14 kgs, or maybe you can say around 10 to 15 kgs approximately, depending on the average weight gain. How much should a mother gain in each trimester? Around maybe 3 kgs. And this is going to give you a baby which is around 3 kgs of weight when it delivers. So everybody needs to gain weight. Now, if you're gaining weight, you gain a healthier weight. It should not be a weight which you cannot lose later on. So what I'm addressing to is taking off more of proteins rather than fat-rich diet to have more weight gain for the healthier baby. And 75 of percentage of our Indian women are anemic. They have low hemoglobin. Let it be city, let it be rural area, let it be underprivileged, or let it be rich people, whoever it is. But overall, the data is saying it is underweight women and anemic women which are having the most serious pregnancy outcomes, and this could be easily corrected if we were taking proper care, improving the hemoglobin of the mothers. Now, not only that the mother's health will improve, but the baby's overall development in the womb and after the delivery also, the neonatal outcome, the infantile outcome, the child mortality around 5 years of age could also be taken care. So please, mommies, listen to me when I'm sharing this data with you, that the infections post delivery, either in the mom or in the baby, are also very less if this one important factor is taken care of, that the maternal weight gain and the hemoglobin of the mother is corrected well. Now, as a doctor, we'll be giving you iron, folic acid, multivitamin tablets to improve your hemoglobin. And in hemoglobin, it's not only the heme or the iron component, it's also the globin, that is protein. Now, if you're not taking enough amount of proteins in your diet, so the iron or vitamin tablets which we are giving are actually not going to benefit your system. The basal iron level in your body is around 280 milligrams, but in pregnancy, the total iron supplementation which you need is around 1000 milligrams. Now, from 280 to 1000 is a big journey. You have to take supplements daily. Also, with that, iron rich food. Now, what is iron rich food? Any food which changes its color when you keep it on table, let it be your pears or apple or banana, which kind of becomes little reddish after cutting. That fruit has iron. Even green leafy vegetables or sprouts have iron. You can cook food in iron vessels. पुराने ज़माने में we used to have लोहे की कढ़ाई. I am from Delhi, so we used to make chole in लोहे की कढ़ाई, so that they used to have rich gravy color. It adds iron to your diet. Similarly, a important macronutrient, calcium. Everybody knows calcium is very important for bones. So if you are having teeth issues in your pregnancy, you're feeling bone pains, you're having backache, that means you're not having enough calcium. So calcium is also important to develop the scalp of the baby. Now, the baby's head has to be supported very well when it is coming out, and enough calcium, especially in high risk pregnancies, elderly pregnancies, the baby must have a good amount of calcium, because so many times they are coming premature. And then these premature babies, if they are not having enough calcium during delivery, the bones are very supple and can get affected. And total calcium concentration falls in the blood level of the mother because the blood volume is increasing, and the albumin is also being taken by the baby. So total calcium content in general is also going to get lower. So you need to add calcium, and normal levels of calcium in your blood are 9 to 11 gram per cent. But in pregnancy, if you will check, it is going to come a little lower. So it's important that you take calcium, magnesium, and vitamin D supplemented tablets as per the advice of your doctor, and also add milk products, vegetables, fruits like guava, pear, and lots of fruits in your diet. If you don't like fruits, you can make some fruit smoothies. If you don't like green leafy vegetables, you can put greens and make some kind of porridge. But try taking a lot of calcium, 1 to 1.5 calcium a day from third month onwards in pregnancy. You are feeding your child. Let it be 9 months post delivery or 1 year post delivery, but you must continue with the calcium. Especially if you're a mother who's having thyroid issues, it's very, very important that you're taking enough calcium and vitamin D supplements. And all the mothers who are 30 years of age and above also need a high calcium supplement. Similarly, the proteins. Now, why should we take a protein? Because the bodybuilding, we know is happening only because the calcium we take is not going to get absorbed and utilized if we are not taking protein. Similarly, iron we said is heme and globin, so that is again iron and protein. And for the baby also, all the body organ systems are forming of proteins only. And how do we find proteins in Indian diet? It's very simple. We are taking lentils, chickpeas, kidney beans, baked beans, tofu, wheat flour, dalia, bread, especially brown bread, or pasta, oats, cornflakes, almonds, nuts, all kinds of nuts, walnuts, hazelnuts, and milk, eggs. All these are very rich in protein. Similarly, we get a lot of animal proteins also, like mutton, fish. So these sources are easily available, and if you take enough protein, that is 1 to 1.5 grams of uh, per kg body weight supplementation. If you're taking, suppose my weight is 60 kg, so I'm supposed to take 60 to 80 grams of proteins a day, and that is very easily possible to take in an Indian menu. And in case you are not able to take that much protein, then the baby is going to come low birth weight, and especially in high risk pregnancies where the placenta is differently formed, it doesn't transmit the nutrients so very well to the baby, so in the end we don't get a good result. And then mommies, it's very tiring journey in NICU for the baby as well as for you as a parent. So please try and calculate the amount of calories you're taking. At least 2000 to 2500 calories per day you must be taking. And in all high risk pregnancies, 1.5 grams per kg of your body weight you should be taking as a protein supplement. Now, one very important thing is omega 3 and DHA. These two factors are very important in all pregnancies, and more so in cases of high risk pregnancy. And how do you take them? These are all available in your routine nuts and antioxidants, and they're very vital for your metabolism, more so for the brain development of your child, antioxidant action, immunity level of your baby is going to come through only these. So try taking more and more of omega 3 and DHA supplements. And in Indian community, when we are taking dal roti sabji, most of the times we are not getting these omega foods, so you should add more of raw foods, more of sprouts, more of salads, and more of fruits. If you don't like to take them raw, maybe you can put it in the form of a soup or a mixed salad or some smoothie or some fruit shake. Cereals and legumes which you take in dal roti sabji usually lack in some or the other amino acid. But if you're trying to take all the different kinds of grain on the platter in one or the other meal, then taken together, they will cover up the deficit for each other, and baby is going to get a wholesome protein, which is very important for the development of his body. Now, in high risk pregnancies, it is important that we are taking good carbs in the diet and avoiding bad carbs in the diet. Now, which are bad carbs? Bad carbs are the carbohydrates which increase your blood sugar level very high. Now, if it is a diabetic pregnancy, a hypertensive pregnancy, a pregnancy in obesity, elderly age, high cholesterol, and you are taking something which increases your blood sugar, blood cholesterol levels suddenly very high, these are all bad carbs. And what are good carbs? Which are slowly taking the blood levels to the optimal stage and slowly declining. So all these things are very important. And if you're having unhealthy eating trends, that means you're skipping your main meals, you're craving for sweet snacks or drinks, taking a lot of fatty fried foods intermittently, having an imbalanced meal, not having a regular meal time. These all things are going to make the bad carbs rise in your blood, and then that is going to affect your child's growth. Like intermittently it's going to be normal, intermittently it is going to be affected, and then there will be complications. Complications means at least 94% of the women will have some health problem related to the bad nutritional habits. And the long term complications, that means even after your delivery, 6 months later, you are going to have some other issue in one on three circumstances. Some of the mommies have more of vomiting, more of pains, more of blood thickening disorders, or some other infection, allergies, some other food allergies, or little stress. So all these things are going to improve if you're taking a balanced diet. Similarly, the baby's infection rate, the immunity, overall growth, overall brain development is going to be taken care if you're taking all the nutrients properly. Now, which are the micronutrients you should be taking? So, as we all know, vitamin D is one of the most important. It's easily available from the sunlight, especially in the morning hours. So, vitamin D around 2000 international units per day is required. If you can't take that, maybe you can take some weekly or 2 weekly tablets, which comes in 60K form. Usually, most of the doctors are giving calcium supplements or iron supplements also with vitamin D. So, discuss it out with your doctor. And this vitamin D is going to help you overall. Other than the sunlight, also, you need to take some oral supplements. And if you take it with some milk product, the absorption is much, much better in pregnancy to prevent rickets in your baby and your own bone pains and calf muscle pain, backache, all these things you should stress on taking proper vitamin D supplementation. Similarly, vitamin B12 is very, very important in Indian scenario because many people are pure vegans. And then this B12 is important for the formation of the nervous system. If you yourself are feeling some kind of tingling, numbness, or in different body parts, that means it could be a B12 deficiency. Go on checking B12 levels in your blood, and this can also lead to a specific kind of anemia in you and your developing baby. Acid and B12 are very, very important for the overall growth, especially of the red blood cells in your body. Magnesium along with calcium is very important, as I previously shared. And zinc मतलब जिस पुराने ज़माने में they used to make food in zinca vessels, but these days we are using more of steels and glass vessels and copper vessels, which are also equally good. But then zinc in the proper amount in the food, it is easily available in the raw foods. So try taking at least 20% of your food in the raw form, which is like ready to eat from the natural sources. Now, if the weight gain of the mother is not optimal, the baby is going to have issues, not only in the structural or the overall weight, also in the form of brain intellect. And there are 8 different database studies worldwide which have suggested that the baby's weight gain either too less or too much, either ways, is going to cause complications in the later life. That means early childhood diabetes, early childhood kidney diseases, early childhood immunity disorders. So these all are related to the weight gain and the kind of nutrition the child is getting in the womb. So mommies, this is your responsibility specifically. Of course, the doctor and the family and your spouse is going to support you, but you must understand the role of individual macro and micronutrient. In case you have any queries, you can reach a grab and then we'll be able to answer you very well one on one. But then if you're not understanding this, it is going to cause some or the other harm to the baby, and it may not be evident at the time of birth, but later on the follow-ups might suggest, and then you may regret that you couldn't take the supplements properly. Now, maternal protein intake and baby's weight, 20 years of life pay, if you see, also has a correlation. Matlab, today you delivered a child and your protein intake was not good. When your child is 20 years of age, it has a connect. So it's very, very important, and more so in case of female babies, like their puberty, their growth, their PCO development, all that is happening uh, by the mother's proper nutrition. And if they're not growing well or they're having early childhood disorders, adolescent disorders, the root is found in the nutrition taken by the mother during the pregnancy. Similarly, if the mother was taking less proteins and more carbohydrates, matlab 3-4 chapati and little dal throughout the pregnancy, the childhood blood pressure symptoms are found. That means these babies could have a high blood pressure problem from the childhood. So such importance is being given to the maternal nutrition these days worldwide. And as Indian mommies, it is our responsibility to be more and more aware, especially if you're undergoing a high risk pregnancy. Try and take all the supplements in a balanced and equanimous form. Preconceptional issues also, like if you had a cholesterol issue or some thyroid issue or some metabolic issue, liver issue, please try and solve it. And during the pregnancy also, try meeting the expert doctors and check these levels of various nutrients parameters regularly, so that the hypertension, diabetic issues and thrombosis or hypercholesteremia issues do not make you suffer, and also your baby. So good nutrition is definitely an important component for getting a healthy mommyhood. The best time to start this is preconceptionally, but then throughout the conception we must be careful, and as soon as we deliver, the duty doesn't end. We need to be taking care till the time we are lactating the baby. Similarly, when weaning the baby off from the breast milk, we must be taking care that the baby proper nutrients. And the most important time for fetal development is during the first several weeks, like immediately preconceptional to the first 14 weeks. All the body organs are developing. So there is rapid transformation in the system. There is very rapid development going on. And this is the very, very crucial phase. And most of the mommies are even not aware that they are conceiving at that point of time. So prudentary lifestyle changes, nutritional changes several months before conception until post-delivery are important. And weight gain is mandatory. Please don't confuse it with obesity. Similarly, it is the only lifetime when it is encouraged that you gain some weight, because there are various organ systems, little tiny systems, various growth spurts. So if you're having a normal weight gain, if you're giving all the nutrients all the time, it's going to have a very beautiful result throughout the life of the baby. These 40 weeks of pregnancy are a magical time. In high risk pregnancies, sometimes we have premature deliveries. So, keeping a very healthy lifestyle throughout the pregnancy, the first 3 months of pregnancy is important. In vomiting, which is happening in spite of the various pills you're popping in spite of various mood swings you're having, you must try and take proper amount of nutrition. And if you're not able to take good amount of nutrition, try taking it with light, little bit of exercise schedule so that you enjoy your pregnancy. Vitamins, minerals, proteins, iron, everything is important. And avoiding alcohol, tobacco, various drugs, other harmful substances is also equally important. The guidelines are given for all the pregnancies, and our Indian organization of obstetrics and gynecology also supports and gives standard protocols for all the mommies. We have various helplines also available in women. One of them is baby chakra, and specific dietary plans or one-on-one query solution also. But then there you must follow it yourself, that what actually you have tried and what still is the query. A malnourished pregnant woman will have a lot of medical complications. Even fetus may have some kind of a handicap, and we can never ever correct it if it is not started developing well. In spite of all our efforts, sometimes the result is not optimal as we all wish. So, again, I'll repeat, nutrition is one thing which you can give to your baby. Also, I, as a gynec, have understood the mommies who have put in efforts have got lovely results. So one important question by Nisha is like, I'm a diabetic and I'm pregnant, so do I start with some extra tablets, and how can I cure myself, and can it happen to my child as well? Yes, Nisha, there are chances that the child can have diabetes, though not very high. In diabetic pregnancies, the sugar fluctuations are more due to the effect of pregnancy hormones. Pregnancy itself is a diabetogenic state. So, we definitely give you the dietary recommendations. You start taking good carbs, which have a low glycemic index, as I suggested. Like if you're taking pastries and high sugar foods like Coke and sweet drinks or some kind of ready to eat junk food, they increase the blood sugar levels very fast. But then you're taking raw foods like salads, fruits, whole grains, nuts, they increase the sugar very slowly. So rather than taking a fruit shake, you can take a soup. Rather than taking a bread, you can go for a jowar ka chapati. So these kind of small dietary modulations and regular monitoring of sugar levels. And in pregnancy, we don't recommend lot many sugar tablets, but we try and regulate those levels by insulin injections. So you can consult an expert, a medical endocrine expert, and of course your obstetrician. So not only the extra tablets, but a proper lifestyle, exercise, nutrition charting, and time to time monitoring of your blood levels of sugar and your growth is very important. Pratibha, thank you so much. You can stop supplements in the 9 months if your hemoglobin is 14, your all blood levels are very, very normal, and you're taking a wonderful diet which includes at least 2,500 calories with around 60 to 100 grams of proteins as per your body weight, and you're able to supplement 1 gram of calcium in your diet daily. If you're able to take that much, I will not actually recommend a supplement then. And the nutrients and supplements which support during IVF are the ones which I was discussing throughout. IVF pregnancies are more stresses, the vomitings, the mood swings are more often, and most of the times they are twin or triplet pregnancies and kind of high risk pregnancies because the mommies may be elderly and may have some other metabolic syndromes. The macro and micronutrients which I shared during my talk need to be taken more religiously during IVF baby care. And these supplements are almost the same indicated in the natural pregnancies, but the role of antioxidants, the role of micronutrients like zinc, like DHA, like omega are more during the IVF pregnancies. If you're planning for IVF, you can start with the supplements like iron, folic acid, B12, vitamin D, vitamin E, vitamin C, and DHA as per the blood levels of parameters which you have, and meet a doctor. Usually we start folic acid, B12, vitamin C, and vitamin D for most of the mommies who are planning a conception. And control your cholesterol levels. Look at the glycemic index of the foods you are taking. Have a good regulation of HbA1c, that is your carbohydrate metabolism. And in assisted or IVF pregnancies, the special care must be taken that the growth of the baby is optimal. These placentas are more sensitive, so they need more of rest, more of fluids, like the blood in the system, the drug or the nutrient you're taking to the baby or in the system is only happening through the water flow. So you must have enough amount of fluids daily. And any specific foods which are good undergoing IVF is the question which we get very often. So we say 40% of your platter should be raw foods. Raw foods मतलब जो आप नेचर से लेकर डायरेक्टली खा सकते हो, that food if you're taking 40% is one of the best meal plans. And also have balanced regular meals, and how you're feeling is very important. Thank you so much for your patient listening, and I'm very, very happy. Thank you, Baby Chakra team, for giving me this opportunity to share my views about high risk pregnancy and IVF pregnancy, especially needing special nutrient care for best outcome of the babies and the mothers in Indian subcontinent. Thank you.